Welcome my friends, this is Bob Schrupp. Today we're going to again talk about vertigo. That is that spinning sensation that you get when you turn your head into a specific direction. And what we're going to be showing you today, or what I'm showing you today, is a specific treatment for that spinning that is quite often very effective. Now the thing you need to understand about vertigo, the most common cause of it is Bppv, which is benign paroxysmal positional vertigo. Now it's a mouthful, but what that is talking about is those little canals that are in your ear. There's 3 of them, and the most common problem with those canals is when you get some debris that breaks loose from the utricle actually and breaks free and ends up in one of those little canals. The most common canal affected is the posterior canal. You don't need to know that, but this treatment today is for the most common cause of vertigo and for the most common type of Bppv. So, this is the first one you're going to want to try in most instances. Now, I already showed you how to do the treatment for for symptoms that go to the left. Now I'm going to show you for symptoms that when you're commonly are feeling dizzy when you turn to the right, or when you roll over to the right, or when you bend your head over and you turn to the right. It's kind of the right-sided symptoms where you've noticed that. And I'm looking for that the symptoms, even though you turn to the right, they generally don't last more than a minute. If they last more than a minute, the dizziness and the spinning, then this may not be right for you. We may have to try something else. And I'll be showing that in some of the future videos. But if it's less than a minute, your eyes may be going back and forth, and you may be feeling kind of a loss of balance for the rest of the day, but the spinning only lasts for less than a minute. So this again is going to be the right Epley Maneuver or right Canalith Repositioning Technique that for symptoms that go to the right. So first off, before you do this, I want to make sure that you don't have any neck problems, that you can turn your head at least 45 degrees, and I'll show you what that is in a minute, but you can also bring your head back. If you can't do that due to arthritis or any other condition, you can't be doing this technique. It's just not going to be correct for you. 45 degrees. You have to know what 45 degrees is turning your head, because you need to do it throughout this technique. As I move my head straight forward here, it's at 0 degrees. Right way over to here to the left, that's 90 degrees. Right in the middle is 45. So I'm looking 45 degrees to the left right now. I'm looking 45 degrees to the right now. So I'm going to be having you do that in just a minute here. In fact, let's go ahead and start off. I'm going to have you use a pillow, and that's going to help you bring your head back. If you put that on the floor or you need it on a hard surface, a bed might work if it's got a pretty solid mattress. So we're going to start with again, you're feeling symptoms to the right, so we're going to start with your head turned 45 degrees to the right. And I want you to make sure you keep your eyes open throughout this entire procedure. And each position you're going to hold until the symptoms go away, or 20 seconds, whichever one comes first. So I'm going to start with my head turned 45 degrees to right, and I'm going to back up over the pillow, and my head's still turned to the right, 45 degrees, and now my head is bent back about 20 degrees. And I'm waiting the 20 seconds or until the symptoms go away. And now I'm going to go ahead and turn my head to the left. Still keeping my head back about 20 degrees. My head is still 45 degrees to the right. I'm going to hold that for 20 seconds or until the symptoms go away. And now I'm going to roll over onto my left shoulder and turn my head 45 degrees down. Same thing, 20 seconds or until the symptoms go away. And then after that, I'm going to go ahead and push myself up into the seated position. And once up in this position, I do not want you to look down. In fact, what we used to have people is wear a collar for up to 2 days, 48 hours afterwards. And they don't think that's necessary anymore. They do think, though, most of the agreement now is that you should not look down. You may want to wear a soft collar for the rest of the day. In addition, if your symptoms were to the right, I would not lay on your right side at night for the next 2 nights. And I would probably sleep with a couple pillows underneath your head, keeping your head up a little bit during the night. Try those things. If they don't work, or if you do get some relief, it's probably the right thing, and you may want to do it again in a couple days or a couple weeks if you get the symptoms back. But if those don't work, we got some other things you may want to try, and we'll have those in some future videos. Please subscribe. Thanks a lot.